I'm Maryanne Comaroto, columnist for the Beverly Hills Times and international radio talk show host. We're at the Hollywood 2010 Oscar GBK Gifting Suites, and right now we're talking with Dr. Rashid about something very specific.
Hi, how are you?
I'm very well. How are you?
I'm doing well, thank you.
What are we talking about today?
Well, we're talking about really the state of health in the United States, which used to be the first or the second as far as healthcare was concerned, and now we've dropped down to 34th in the world. So the question is why? And I was having a conversation with your friend, and we were talking about...
My husband.
Oh, your husband. Okay, so I guess he would be your friend too, or he's not your friend?
And he's my best friend.
Okay, great. So we were just talking about some of the reasons why that type of trend has taken place, and essentially what it comes down to is we're living in more toxic of a world than we used to live in previously. And we've had patients from 37 different countries, 42 different states that have come to us with conditions that have been considered non-curable or incurable, and we've been able to document these people getting better. And we've videotaped their transition. We've videotaped them from the beginning till the end, and what their own journeys were. And what's been interesting is that instead of my profession wanting to know what we did to effectively help these people, it actually had an unanticipated outcome where I was actually ridiculed and told that our science isn't based on anything and that this is all quackery and witchcraft. And what's really interesting is that we've documented this on video. So 2020 was in my office just on Monday, and they were interviewing me, and one of the things that the on-air host was talking about, he said, well, Dr. Buttar, the problem is that what you've done with all these videos out there, and there's a couple of hundred of them out on YouTube, and one of those videos went viral. 15 million people saw it all over the world, translated to different languages. He said, these videos, they're not scientific based. They're anecdotal. And I said, listen, if you were sick and you got better, is that anecdotal to you? Is that 100% your experience? And he says, look, and of course he didn't want to talk about that. And he said, let's just talk about science for a second. He goes, this isn't scientifically based. This isn't been tested with the scientific model. And I said, excuse me, what do you mean, the scientific model? And he says, science, like actual science, where the studies have been done to establish this to be the truth. I said, are you talking about the double-blind, placebo-controlled, crossover, multi-center trials that led to the approval of drugs like Vioxx that killed 55,000 people before they took it off the market? Are those the type of studies you're talking about?
And Dr. Buttar, tell us what the it is that you are actually doing.
Well, essentially, the it is 3 steps, and those 3 steps are: the first one is detoxification, systemic detoxification, effective systemic detoxification. A lot of people talk about detoxification, but it's lip service. So first is cleaning up the system. Second is immune modulation. And the third one is physiological optimization, meaning you optimize the body to work the way it's supposed to.
And how is this different from some of the detox programs you're hearing about now, right? All these cleansing and detoxing and fasting and all of that. What have you got going on that the other folks don't?
Well, I think that's a great place where they're starting. We do a lot of intravenous therapies. We have 39 different intravenous therapies that we do to help get metals out of the body, to help get persistent organic pollutants out of the body, to help reduce the effect of energetics like the electromagnetic radiation and the ambient cell phone radiation that's affecting people. So we do certain things to help to get rid of the effects of those types of toxins. And unfortunately, most of the detox programs that are out there, they're more spa related, they're more to try to help your skin look better, which is great, and it's important, it's a good step, but that would be more like a tricycle, and we're more like the Learjet, if you will.
What do you say to folks who maybe, mainstream America, a lot of us are busy trying to bring home the bacon.
Yeah.
So when you're offering us a program to detox and purify ourselves, does this feel a little bit beyond the average person's reach, or is this something that most of us can embrace easily?
I don't know if you planned that question now, but that was a great question, because the book is called The 9 Steps to Keep the Doctor Away. So that was really perfect timing to bring up the book, because that really
that's why I do what I do.
Well, that's actually the book would actually give a framework of what an individual can do to help achieve a better outcome. And the goal is that if you can live a cleaner, healthier life, then that should translate into a longer life, and that's exactly what we've done.
Dr. Buttar, what are some of the alarms, some of the things that we should be aware of that maybe some of us aren't paying attention to, that we need to attend to right away, that later on, or even not so far down the road, could turn into something that we cannot fix?
And that's such a good question, and it's such a loaded question. So I'm going to try to give a bird's eye view from a perspective of a physician, what I would say that people should look out for. If you end up having a pain or you end up having an issue that drives you to a doctor and they give you a medication to cover up the symptom, the first thing, alarm should go off in your head, because that's not the right thing to do. It would be analogous to having a car with a flashing light on the dashboard, and you go to the mechanic and say, hey, I've got this flashing light, and the mechanic saying, oh, I can fix that, and takes the bulb out. So, you wouldn't go to a mechanic like that, right? Nobody would take
The thing is, I might. That's what I'm asking you. We're all so conditioned to treat the symptom. We don't have time. We don't want to drop into our bodies because we have yet to make that real crucial link, which feels like a chasm for some of us, from what everybody else is doing, what I have time to do, to optimal health. And what I'm hearing you say is this book is going to be what bridges that gap for many of us.
It certainly will be the first step to help people understand why they don't want to take the drug that covers up the symptom. Because if you do that, what you're essentially doing is preventing something that God designed to warn us, that the Creator designed to tell us that, hey, be cautious because you got a problem here. And so when we suppress a symptom, we get a false sense of security that that's not the problem. And that manifests later into the heart attack, the cancer. I mean, the number one symptom of heart disease, do you know what that is?
Death.
Sudden cardiac death is the number one symptom of heart disease. So people,
I knew that.
So people get all these drugs to prevent these problems, and so they think they get this false sense of security. I'm taking my blood pressure medication, I'm taking my angina medication, and boom, they end up having the heart attack. That pain that they were having, that shortness of breath, is a warning that you need to make a change. And contrary to popular belief, we weren't born with a shortage of statin drugs or whatever. I mean, we didn't have a statin drug deficiency or a beta blocker deficiency. What we really have is a problem with what we've been doing all our lives to get to that point. And then when the signal tells us, hey, be warned, what do? We get rid of the signal.
Dr. Buttar, how can folks find out more about your book and more information about what you're doing?
Our website for the clinic is drbuttar.com, and it's Buttar, drbuttar.com. But the book information, you can actually, all the online bookstores have it. People can pre-order it. But we do have a special video series called Know Your Options, a medical series, and these videos retail for around $90 on Amazon. And right now, if people go to get the book at the9steps.com, they can get the DVD for free. In other words, a DVD for free for each book they buy.
Last question. We have 1 second to 30 seconds to tell folks why they need to pay attention to their health in this particular way.
Well, you can either pay the payment now or pay 100 times more later, and possibly with your life. So there's no machine in the world, in the universe, that's been built like the human body. It's the only piece of machinery, the more you work it, the better it gets. Everything else, you measure in hours or mileage or whatever, and then the engine wears down and the value goes down. The human body, the more you use it, the better it gets. So people need to understand this philosophy that you clean up the system, allow it to do what it was designed to do, and you'll get enormous benefits.
Thanks for being with us. I'm Maryanne, Comaroto, columnist for the Beverly Hills Times Magazine with Dr. Buttar. Thanks for being with us.